morning, ma'am. My name is Christopher Casar Antonio, and then in my script, I'm playing double person. At the first, I'm playing Mr. Iko, the husband of Miss Ita. And the second, I'm playing Dr. Miko. Dr. Miko is the doctor in the Gospel Hospital. And then I will to explain the short movie or the short story in this script. There is an old woman with 50 years old. She has the symptom like her weight is down. Her weight at now is 55 kilograms. And then she has also the wound in the left of her leg. And the third, she is always want to urinating in every time. In the fourth, she is feeling exhausted and tired in every time, even though she has not to do something is too hard. And then her child and also her son-in-law check her go to the Gospel Hospital. And then the diagnosis of the nursing are include the interference skin integrity or tissue and also instability of blood glucose levels. And then after that she has the blood sugar level is 240 mg per dl. And then she has to suggest from nurses and the doctor for stay in the hospital until 1 or 2 months. And then she has agreed with that, and as long as she has the good recover from her sick, and the last her blood sugar level is down, and but her wound is not to recover, but she is very happy because the blood sugar level it can be recovered. And thank you, and I want to say that if any wrong with this video, I say sorry, and also if this video is not too perfect, and we must say that sorry. Thank you.
Good morning, ma'am. My name is Apeana Kong. I am nurse in as nurse laboratorium.
Good morning, ma'am. My name is Maria Angelina Satusenga, and then in this role play, I am as Nurse Nini. Thank you, ma'am.
Good morning. My name is Lucida Fasti. I'm as Nurse Vina.
My name is Michelle Intani Kartika. I as Mrs. Ciplu, patient diabetic.
Morning, Miss. My name is Salomine Pere. I as Miss Ita.
Good morning, ma'am. My name is Yunifana Inkua, and in the role play, I am as Nurse Tian. Thank you.
At one day, there is one woman with name Miss Ciplu. Miss Ciplu, her full name is Miss Ciplu Tumini, and she was born 1970, and at now she is 50 years old. She has gender diabetic some years ago, specific is 5 years ago. Her husband was dead 5 years ago with accident in the traffic signs. But Miss Ciplu has one child named Miss Ita. Miss Ita is the only one of Miss Ciplu's child. Miss Ita, his full name is Ita Purnamasari. At now, Miss Ita has a husband with name Mr. Iko. Mr. Iko is 35 years old, same like his wife. But Miss Ita and Miss Iko don't have any child because some reasons. At Monday, she is complaining that her weight is down every year is 3 kilograms. Before that, specific 5 years ago, Miss Ciplo has 70 kilograms. But at now, she is just 55 kilograms. She is very confused with it. And also, in the everyday, she is feel very exhausted without doing work hard. She is confused and already to talking with her doctor and her son-in-law.
Oh my god, what does happen, Mom?
Ita, when my weight is down, a very year's down is 3 kilos. This makes me stress.
Really, Mom? How many kilograms for 1 year ago, Mom?
59 kilos, and also I always feel exhausted and tired but don't doing work hard.
Okay, Mom. Wait, is someone? Mom, I will call my husband and ask about it.
Sure, Ita.
Daddy, where are you?
I disappear, you cannot see me.
Where are you, darling?
In here.
Oh my god, you make me shocked. That my mom was say with me that her weight is down 3 kilograms and also she is feel very exhausted every day.
Really? Really?
So that and I also really, but you don't work for it.
Up to you, babe. Up to you.
Hey, Justin Daddy, come on, check her condition.
Okay, come on. Let's do it.
After that, talking together, and then Mrs. Ita and Mr. Iko go to check their mother and suggest Mrs. Ciplu for agree go to the Gospel Hospital.
Ma'am, are you okay?
No, son.
I was here that your weight is down and also you are feeling exhausted and tired in every day even though you not to do anything hard work.
I was sure, my son, that's true. And also, honestly, I have the wound in my left legs 5 years ago. It can being well.
Okay, let me see, ma'am.
This is
Wow. Oh my god. Okay. You must go to the Gospel Hospital right now. I was I was so very tired about you, ma'am. I was feeling that you have the general diabetic.
Really? Why you know it?
Ha, great diabetic.
Sure, I was know it when I live with my grandma.
But mom, why you not say if for me that you have what mom?
I can say it because I think that uh, this one is Son Severus.
No mom, you must to say all that for fear. Meet or my husband.
Oh, I'm sorry.
Okay, ma'am, no problem. We must go to the Gospel Hospital. I will to deliver you in there with my car.
Sure.
Okay, let's go. After agree for go to the Gospel Hospital, and then they are going together with a car. And then after 1 hours for the trip, and then they are arrived at Gospel Hospital.
I want to deliver my mom in the room.
Oh, good morning too, ma'am. Let me introduce myself. My name is Nurse Nini, and she is my partner, Nurse Vina. But before that, you must registration first.
Sure, ma'am. My name is Nurse Vina.
Oh, really? I'm sorry, nurse, I forget it. Oh, let me introduce myself. My name is Nurse Ita, and my husband, he is very handsome, that right.
Sure, ma'am. He is very handsome.
Nurse Vina, come on top, please. Okay, ma'am. No problem. You can registration first, and then me and Nurse Vina will take your mother for go to the room.
Hey, Daddy, can you registration first?
Sure, baby.
Huh? Baby?
Nurse Vina, keep silent, please.
Oh, I'm sorry.
Hehe. Sure, she is my beautiful woman in this world, and I never see her anymore.
Ah, Daddy.
Okay, sure.
Oh, okay, I'm sorry. Okay, I will do registration first.
Yeah, sure.
Come on, Mom Ita. You can follow us.
Sure, nurse.
Next topic. The assessment. After that, and then Mr. Iko go to the administration nurse for registration. After 10 minutes, and then Mr. Iko going back to the Miss Chipluk's rooms again, but in the chairs out of room.
Interview first. And Nurse Vina, please help me.
Sure, nurse.
Okay, ma'am. What's your full name? And how old are you now, ma'am?
My name is Mrs. Cipluk Tumini, and I am 15 years old.
Okay. Nurse Vina, what time is it? And what is the day?
It's on 4th Monday, 2020, and it's 9 past 20 o'clock.
Okay, ma'am. What the religion, your address, and where are you from, ma'am?
Let me answer it. Our religion in Catholic, berlife in Sugasar and Sukoharjo Timur Street number 3C, and work from Central Java.
Okay. What's the job that you do, ma'am? And before you visit in here, your was check your condition in other place, ma'am. And also, where your husband, ma'am?
Let me answer again, nurse. My mom always stay at home, and she is just doing the simple work at home and elsewhere don't visit other place. Just this day, and my father was dead because he is sick.
Okay. What's your feeling now, ma'am? And how about your condition?
Oh, my weight is down for 5 years ago, and my weight is 70 kilos, but now 55 kilos. I feel very exhausted and very tired, but I don't do hard work. And also, I have a wound in left leg, nurse. This wound was happened 5 years ago.
Oh, is there a history of past illness and is there a family disease, ma'am?
No, nurse.
Okay, before in here, are have been a consumption the medicine?
No, nurse.
Do you have allergens and do you do the blood transfusion before, ma'am?
No, nurse. I don't have allergens and don't do blood transfusion before.
Oh, okay. Nurse Vina, please check your vital sign.
Sure, nurse. Excuse me, ma'am.
Oh, yes, nurse.
After 50 minutes, her blood pressure is 120 per 70 mmHg. Temperature is 36 degrees. Her respiration is 18 times per minute, and her pulse is 65 times per minute, and also strength.
Okay, nurse. Okay, ma'am. Do you have breathless, ma'am?
No, nurse.
Okay, let me check your breath.
After 5 minutes,
Okay, ma'am. Your breath is overall is okay. And also, I will check your circulation.
Nurse Nini, let me check her circulation.
Sure. And also, please check her precision and sensory, and also her pain.
Sure, nurse. After 5 minutes, uh, overall is okay, nurse, and there is haven't a pain.
Okay, ma'am. How about your poops and your urinating?
Overall is okay, nurse. Don't problem.
Okay. How many you poops and urinating ever one day, ma'am?
I always poop within 3 and my urinary 10 time, nurse, because I always want to urinating every 10 minutes.
Okay, ma'am. How about your drinks, ma'am?
I always drink 8 until 9 glass every day, but always feel thirsty.
Okay. How about you? How about the color, ma'am?
Oh, my poop is yellow soft and also my urinary is yellow.
Okay. How tired are you, ma'am?
Okay, nurse, let me answer it her. Hey, it's 16 for nurse. I was checked it 5 days ago and are home.
Okay. Let me check your mouth and your stomach.
Nurse Nini, let me do it.
Oh, okay, sure.
Excuse me, ma'am. Open your mouth, please. Okay. You can sleep in the bed and I will check your stomach.
Guys, bentar, stop
Okay,
bentar.
nurse.
Excuse me, ma'am. Please open your mouth. Okay. You can sleep in this bed and I will check your stomach.
Okay, nurse.
After 5 minutes. Okay. Thank you, ma'am. Nurse Nini. Her tongue is dirty. Her mucosa is dry and also her frequency of her peristaltic is just 5 times per minute.
Okay, thank you, nurse. Ma'am, how about your food intake?
She is always eat 3 of her day and always finish.
Okay, let me check again about your activity. How about your activity, ma'am? I mean that when you do the activity like take a bath, wear the shirt, go to the toilet, and anything else, is help with your family.
No, nurse. I always do it by myself.
Okay, let me check your skin integrity and your neck.
Sure, nurse.
Okay, excuse me, ma'am.
Okay.
After 5 minutes. Okay, ma'am. Overall, is good, but your skin is dry, ma'am. How about your reproduction? Do you have been menopause?
I
And
don't have.
okay. And then, how about your sleeping, ma'am? Does your sleep is 8 hours every day, ma'am?
Oh, sure, nurse. And I always sleeping in the afternoon.
Okay, ma'am. When you feel like this, I mean, when you have this problem healthy, how do you do, ma'am?
Let me answer it, nurse. We're always do it good principle. I mean, we're always pray with God and always be patient. And I believe that if any problem with our family, it just the God planning.
Okay, thank you, ma'am. Do you have a BPJS or something else, ma'am?
Nurse, let me ask my husband for that.
Oh, sure, ma'am.
Dad, do you bring everything?
After that, and then Miss Ita go back in the room again and telling for Nurse Nini that her husband forget to bring it.
Excuse me, nurse. My husband forget to take it, but he is going back again for take it.
Oh, okay, ma'am. No problem. Ma'am, I suggest you for stay in here for 1 until 2 months.
Sure, ma'am. You must to stay in here because you must to get the best treatment from our partner.
What?
Really? Why I must to stay in here?
Because you are has a problem and it's generally diabetic. But the most important that you must to do is the generic diabetic specific at your wound, ma'am.
Oh my God. It's been very long time to stay in here.
Sure, ma'am.
That's sure. Okay, ma'am. I will check the blood sample.
Oh, sure, nurse.
After 20 minutes, please bring it at the laboratorium for a check the blood sample.
Okay, Nurse Nini.
And then Nurse Vina bring the blood sample go to the laboratorium and wait in here for some minutes to know about the blood sugar level.
Talk, talk, talk. Excuse me, Nurse Ino.
Okay, enter, please, nurse.
Good morning, nurse. In here, I bring a blood sample of the patient, so you can check it.
Okay, wait some minutes later.
Sure, Nurse Ino. After 30 minutes.
Nurse Vina, this is their result and the patient named Mercy Flu as a grain diabetes because the blood sugar level 240.
Okay, nurse. Thank you.
Sure.
Excuse me, Nurse Nini. This is the result.
Oh, okay. We must tell this for doctor. Okay, excuse me, ma'am. I must to meet with the doctor and give this result.
Sure, nurse.
Sure, nurse.
Excuse me, doctor.
Okay, nurse, enter please.
Okay, doctor. In Talia room, there is an old woman with gender diabetic. So I suggest here for stay in this hospital for 1 until 2 months, and they are agree with it.
Okay. Do you want to check the blood sugar level, nurse?
Sure, doctor. It's also the reasons that I will tell you, doctor.
Oh, okay. Let me see it.
Okay, doctor. The sugar level is 214 mg per dl, and hemoglobin is 8.5 mg per dl.
Oh, okay. That's good. So you can give the insulin in every time, and also the most important that you must do thing to do is recover her wound. By the way, are you Nurse Vina?
Sure, doctor.
Okay, that's good. You can learning in here with Nurse Nini because Nurse Nini is the good person and she is very kind.
Oh, okay, doctor.
Okay, doctor.
Okay,
I will back again and doing the next work again.
Excuse me, doc.
sure. Nursing diagnosis, and then they are going to the administration nurse for doing the next work is do the diagnosis formulation and also Read the planning.
At nurse administration. Let me help you, Nurse Nini.
Okay, do it please.
Let me write the diagnosis formulation, nurse.
Okay, you write it, but I guide you step by step.
Okay, sure, nurse.
Okay, the first step we must to do is gender diabetic. So, the first time you must write is subjective data and objective data. Subjective data is mean that anything that the patient said, and the objective data is anything that you check it like blood pressure.
It must I make a table?
Sure, make it. You can check in front of it.
After 10 minutes. Like this, Nurse Nini, subjective data for R include the patient say that have wound and never get better. And the objective data are include there is wound in left of leg of patient. Etiology are pigmentation change and less exposure to information about efforts to maintain or protect tissue integrity. Subjective data for R include the patient say that her weight is down, she is felt exhausted and tired, and the objective data are include the patient has a dry skin, her weight patient is 55 kilogram, and blood pressure sugar level is 240 mg per dl. Etiology is increased blood glucose tolerance.
So, what the nursing diagnose?
Interference skin integrity or tissue and instability of blood glucose level. And the most important to do is intervene skin integrity or tissue.
Sure, that's true.
Thank you, nurse.
Great. So, the next step is you must write the complete of diagnosis with the principle that PAS or problem, etiology, and symptoms. And don't forget to insert the number of diagnosis understand.
Sure, I know. Okay, just like this. Interference skin integrity or tissue or T.0129 is corresponding with pigmentation change and less exposure to information about efforts to maintain or protect tissue integrity proven by the patient say that have wound and never get better, and there is wound in left of leg patient. In the second, instability of blood glucose level or T.0027 is corresponding with improved blood glucose tolerance proven by the patient say that her weight is down and she is feel exhausted and tired. The patient has dry skin. Her weight patient is 55 kilogram and blood sugar level is 240 mg per dl.
Okay, that's true. So, we will next arrange the intervention.
Intervention meaning like the planning that we want to do for the patient.
Sure, that's right. Do you understand?
Sure, I was running it one day ago with Nurse Tiam, but I just learning intervention not complete like this.
Okay, no problem. So, I want you can write the good intervention, but before you write the intervention, you must to complete the surveys.
Surface is mean the purpose of intervention.
That's good, all right. But I will check the other patients. So, I will call Nurse TM for stand in here.
Sure, nurse.
And then Nurse Nini meet with Mr. Iko for take care the BPJS card and doing the next job with other patient.
Good morning, Mr. Iko. Are you husband of Miss Ita?
Sure, nurse. I want to give you the BPJS card. It is.
Okay, Mr. Iko. You must registration, not with me, but in the administration again.
In administration again?
Sure, sir.
Oh, okay. I will registration first.
Okay. Your mother and your wife now is in the Talia rooms, number 5. You can visit them anytime.
Okay, nurse. By the way, how is her condition, nurse?
Your mother is so far, but is fine. She has a diabetic, and I would suggest her for stay in here once month until 2 months.
Oh, okay. Nurse, it is can be recovered, nurse.
Okay, sure. Honestly, the diabetic can be recovered, but we must give her the insulin for reduce the blood sugar level.
Okay. So I will do registration and thank you, nurse, this information.
Yes, you're welcome.
Okay. The intervention. And then Nurse Nini do the next job for caring with other patient and Mr. Iko registration for BPJS. After that, Mr. Iko going back to Talia room for meet his wife and his mother.
Okay, Narsina, we must to be quickly for do the planning because the patient must to be handled.
Okay, nurse Tia. I was finished to write the planning.
Okay, please reading it.
Just like this, the intervened skin integrity or tissue or T.0129 priority surface is skin integrity and tissue. L.14129 to 5 increase with yield criteria are damaged tissue decrease, damaged skin layer decrease, and scar tissue decrease. For the next intervention is injury cure E.14564 with include observation. First, monitor characteristic wound like color, size, and smell. Second, monitor the sign infection. For therapeutic, third, remove bandage and plaster slowly. Fourth, clean up and with an ACL, fluid or cleaning of non-toxic. 5. Apply the appropriate ointment to the skin or lesion. 6. Put a bandage according to the type of wound. 7. Maintain sterile technique when do the injury care. 8. Give vitamin and mineral supplement like vitamin A, vitamin C, zinc C, asam amino. Education. 9. Telling signs and symptoms of infection. 10. Teach cure injury produced independently. For collaboration. 11. Collaboration the antibiotic.
Okay, I will give the rationale for that. The rationale are observation. 1. To know what are the characteristics of wound, normal or abnormal. 2. To know what are the signs infection like blood and swollen. And then therapeutic 3. To give relax and for doing the cleaning won't be early. 4. To the wound be clean and reduce the wound. 5. To give the better skin being normal and not darkness. 6. To get better for the skin for be better. 7. To give the protection so that never any problem again. And 8. To repair and restore the wound to be better. And education, to know for helping the patient to know what are the signs of infection and the knowledge be more. 10. To helping the patient to be independently of if anyone in her body. Collaboration is aimed to give better for patient and the wound be reduced again.
Thank you, Nurse Tiam. And then instability of blood glucose level, or D.0027. The priority surface is stability of blood glucose level, or L.03022, increase with the criteria are coordination increase, tired or lethargic is decreased, feel hungry is decreased, dry mouth is decreased, feel thirsty is decreased, and blood glucose level is better. For the intervention is management of hyperglycemia, or I.03115, which include observation. First, identification situation that the insulin needed increase, like relapse. Second, monitor blood sugar level. Third, monitor intake and output of fluid. Therapeutic. Fourth, give oral fluid intake. In education, 5, suggest to monitor glucose level independently. 7, suggest to management diabetic, like use insulin or oral medical. Collaboration give the insulin and collaboration give the IV fluid.
Okay, I will give the rationale include are. Observation is to know what are the situations that can make the insulin increase, and to know that how about the blood sugar level is up or down, and to know how about the patient is fluid does it stable or not among the intake and output. And therapeutic is to give the patient fluid and better. And education is to give the patient instruction for monitor her glucose level in her body and to give the patient knowledge for management diabetic by herself, like insulin, oral medicines, and intake fluid monitor. And then collaboration is aim to reduce or down up the blood sugar level that patient have it, and aim to reduce or down up the patient fluid.
Okay, thank you, nurse.
Okay, come on, we must to do the intervention. I mean to do the implementation.
Sure, Nurse Tiam.
Introduce myself.
Sure, nurse.
My name is Nurse Tiam, and today I will give the action for you, Mom.
Your Nurse Nina.
Nurse Titi. isn't in here because any job that she must to do.
Sure, ma'am. And Nurse Tiam will to do treatment for you, ma'am.
Okay, nurse.
Okay, ma'am. Let me check your wound first and also check any other that's infection.
Sure, nurse. I have one in left leg, left of my leg.
Okay, excuse me, ma'am. Okay, Nurse Ina, please write that the one is not longer. The size is like and the smell is character.
Okay, Nurse Tiam. Nurse, you must use the hand spoon first and it's the hand spoon.
Oh, okay, thank you. Excuse me, ma'am. May I open this page and also the placer and I will give the NaCl fluid for clean up this one, ma'am.
Does it sick, nurse?
Ma'am, just little sick.
Okay, nurse.
I always discharge you, ma'am. Don't worry.
Okay, excuse me, ma'am.
Sick, nurse.
Okay, don't worry, ma'am.
Slowly.
Okay. Nurse Vina, please give me the alcohol swipe.
Okay.
Okay. I will smell right on admin to the skin or lesion and then I will cuse this wound, this bench and plaster again, ma'am.
Oh, okay, nurse. Let's do it. But you must slowly, nurse.
Okay, ma'am, excuse me.
Ow! Is sick, nurse. Ow!
Okay, it is finished, ma'am. Ma'am, I will give you the sting and symptom of infection.
What are all, nurse?
Okay, the sting and the symptoms are like redness of skin and then swollen, hot skin. Sometimes it's itchy, pus, and also sometimes feel pain.
Oh, okay, nurse. Thank you for the education, nurse.
Sure, ma'am. Ma'am, if any infection and when you was understand about the thing and symptoms, you can cleaning up it by yourself.
So, if infection be longer and big, what can I do, nurse?
Ma'am, you must stay with nurse in here and the nurse will clean up again until very clean.
But it's mean can amputate.
Sure, ma'am. But don't worry, your infection and your wound isn't safer.
Oh, okay, nurse.
Yes.
Nurse Tiam, let me do the next action, please.
Okay.
Ma'am, do you like eating with ingredients is sweet?
Sure. When the situation like breakfast and dinner, I always eating and drinking like tea, cup of sweet coffee, sweet corn, sweet bread, and anything else, and always sweet.
Okay, ma'am. If the situation is like this, that you always eating and drink sweet, it can make your blood sugar level can be up.
But I can eating and drinking anything else. I always like this all.
But you must keep it, ma'am.
Okay, nurse.
Nurse Tiam, I was check her blood sugar level and the result is 240 mg per dl.
Okay, next to the step.
Okay, ma'am. If about the intake and output fluid, that's true that you are drink 8 to 9 glass every day and output is 10 times and also suddenly fail to want to urinary in 10 minutes.
Oh, okay, nurse.
Okay, ma'am. I will give you the oral fluid intake. It can recover your output fluid.
Okay, thank you, nurse.
Okay, ma'am.
And then I also will give you vitamin and mineral supplement like vitamin A, vitamin C, zinc C, and asam amino. Ita iki sapa?
Inandi.
For what? It all nurse.
Okay, let me describe it. So, ma'am, the vitamin and mineral can recover the wound because the contents its many benefits that makes the wound be better and also must consume it be continue.
Oh, okay, nurse. Ma'am, do you agree?
Okay, but now I'll just a half of mineral and vitamin.
But mom, if you wanna be okay, you must finish it all.
Oh no, just a half.
Excuse me, I will give you the antibiotic. It is oral. This is antibiotic can recover your blood sugar level to down.
Oh, okay, nurse. Give me and I will drink it.
Okay, ma'am. Nurse Mina, please help me, and I will prepare the next action, like give the insulin and also give the IV fluid.
Okay, Nurse Tiam. Ma'am, you must to monitor glucose level be independently. It can improve your knowledge and also can control the glucose level in your body.
Does it mean like a control the consumption sweet food and sweet drink bars?
Sure, that's true, ma'am. And I also suggest to management diabetic like use insulin, oral medicine, and intake fluid monitor. You can asking with the nurse in here about your diabetic and as long as you can control all by yourself.
Oh yes, nurse. It's mean that's I can asking about the insulin that's will give for me like the doses, how many use insulin and anything else from the control it, nurse.
Sure, ma'am, you can ask it all.
And then the nurse Tiam go to the doctor room for tell the doctor about the patient. And doctor help the nurse Tiam for give the insulin and also give the IV fluid.
Tok, 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 tok.
Yes, enter nurse.
Doctor, I want to tell about Mr. Ciplo. I want to give her the insulin and also IV fluid.
Do you mean that the patient with general diabetic?
Sure, doctor.
Oh, okay. I was here that heard her symptom, and okay, I will do it.
Okay, doctor.
Okay, by the way, which the room nurse?
Atalia room, doctor.
Oh, okay, come on, to do it.
Yes.
After that, they are going back to the Talia room and also give the action again. But Miss Chiplo does not agree to get it.
Excuse me, ma'am. Suggest you to the doctor said that you must give the insulin for down your blood sugar level, mom.
That's right, ma'am. You must to get the insulin right now.
Oh, no, doctor, no.
Okay, why you say no if you're not to feeling it before?
Because it's about injection.
Oh, okay, I want to describe it. So if you're not to give this insulin, you can be amputated. So honestly, many people in this world can dead because of this. So if you're not to get the insulin, you cannot to be improved for your sick.
Yes.
Sure? OMG.
Sure, ma'am.
It's very sick, doc.
No, ma'am. It is just like when you drinking the water.
Why?
Sure, it is because just relax and calm.
Really?
Sure, ma'am. Are you agree?
Oh, sure, doctor.
Okay, nurse, please help me.
Yes.
After 15 minutes. So, ma'am, it is finished.
Huh? It was finished, doctor?
Sure, I was give this insulin for you. And then I want to injection again. It is just for your body, ma'am.
For what again, doctor?
It is fluid, and it is for your body. It is can recover with your sick. Excuse me.
Okay.
Do you agree?
Okay, doctor. I want to be healthy.
Okay. Okay. Excuse me, ma'am.
Doc, is sick, doc. Is sick.
Just come, ma'am. Just come.
Yes, mom. Relax, ma'am. Relax. Relax, mom.
After 5 minutes. Okay, ma'am. It is finished. And nurse, please tidy it all, and I will back again in my room. If any problem, you can call me in my room. Okay.
Sure, doctor.
Sure, doctor. Thank you.
Okay. Excuse me, nurse.
Thank you, doctor.
Thank you, doctor.
And then the doctor back to his room again, and then Nurse Diem and Nurse Vina stay in here and ask about the feeling of Miss Chiplo.
Okay, ma'am. How about your feeling?
I will be better. But I wanna sleeping.
Okay, Mr. Ciplo. If any problem again, please call me. We touch this bell.
Thank you, nurse.
Thank you, nurse.
Yes.
Evaluation. And then Nurse Diem and Nurse Vina go back at administration nurse again for writing in medical record books after 1 hour after taking the implementation.
Okay, Nurse Vina, I will write the evaluation for today.
Sure, Nurse Tiam. I remember that we finished at 1 p.m. and it's 4 p.m.
Okay, the evaluation are included today on for Monday, 2020 at 2 p.m. Intervention skin integrity or tissue D.0129 and subject data is the patient say that still wound in her leg, and objective data is the wound is left of leg and the wound is no longer, the size is leg ball and the small is characteristic author. And assessment is the goal is achieved in part. And planning is intervention 1, 3, 4, 5, 6, 7, and 8, and 12, instability of blood glucose level D0027. Subject data is the patient say that her weight is still. She is still safe, feel exhausted, but the thyroid is better. And objective data is the patient still says a dry skin, and her weight is still, patient is 55 kilogram, and blood sugar level still is 240 mg per dl. Assessment is the goal is achieved in part, and planning is intervention 13, 14, 18, 19 is to next.
And then the next treatment is to do again at evening by other nurse. And also the treatment is also to do until 2 months. After 2 months, the blood sugar level of Miss Ciplo was down and the wound is starting to shrink but stay enough safer. And also the nurse always give the support and always suggest Miss Ciplo for to be continued to check up at the Gospel Hospital.